Hi, I'm Tara Schmidlin, one of the CPMC genetic counselors. Before you view your results, I want to give you some information about what the results can and cannot tell you. When viewing your results for any condition, it is important to remember that the testing done as part of the CPMC study only looks at disease risk. CPMC test results are not a medical diagnosis. Crohn's disease is a type of inflammatory bowel disease. The most common types of inflammatory bowel disease are Crohn's disease and ulcerative colitis. Crohn's disease is a chronic and relapsing condition caused by an autoimmune response, in which the body's immune system, which normally fights infections and viruses, is misdirected and attacks the body's own normal, healthy tissue. In patients with Crohn's disease, the immune system attacks the tissue along the intestinal tract, anywhere from the mouth to the anus. The inflammation most commonly occurs in patches along the small intestine and the large intestine or colon. Although Crohn's disease can occur at any age, most individuals are diagnosed between the ages of 15 and 30, with a second peak of onset around age 50. Intestinal inflammation can lead to symptoms of Crohn's disease, including diarrhea, abdominal pain, cramping, blood in the stool, ulcers, reduced appetite, weight loss and malnutrition, fever, fatigue, and anemia, which is a condition of having too few red blood cells. It is important that you tell your doctor if you are experiencing any of these symptoms. Without treatment, Crohn's disease can lead to abscesses. Abscesses are swollen, pus-filled areas. Without treatment, Crohn's disease can also lead to blockage of the bowels and fistulas. Fistulas are abnormal passageways between one part of the digestive tract and another, or from the digestive tract to another organ, such as the vagina or bladder. There are many factors that make up your overall risk for developing Crohn's disease, some of which you can control and some you cannot control. The primary risk factors for Crohn's disease include being Caucasian, having Ashkenazi Jewish ancestry, being between the ages of 15 and 30, and having a family history of Crohn's disease. Genetic risk factors can also contribute to your risk of developing Crohn's disease. Non-genetic risk factors, such as smoking cigarettes, can also contribute to your risk, as well as living in an urban area or northern climate. We mentioned genetic risk factors as contributing to the risk of Crohn's disease. It is estimated that about 54% of the risk of Crohn's disease in the Caucasian population is due to differences in genetic risk factors, while the remaining 46% of the risk is due to differences in non-genetic risk factors. It is not possible for Crohn's disease to be diagnosed by genetic testing. Crohn's disease must be diagnosed by a gastroenterologist using blood tests, stool tests, colonoscopy, sigmoidoscopy or endoscopy, and imaging tests like CAT scans or MRIs. Now let's talk specifically about the CPMC results and genetic risks for Crohn's disease. Studies have shown that a particular genetic variant called RS112-09026 is associated with a reduced risk for Crohn's disease in people who have 2 copies of this variant. Remember that we all have 2 copies of every gene. We inherit 1 copy from our mother and 1 copy from our father. This means that for every genetic variant the CPMC study looks at, you can have either 0, 1, or 2 copies. Your CPMC results will tell you how many copies of this protective genetic variant that you have. Individuals who do not have this protective variant will have a non-protective variant instead. Having a non-protective variant does not increase your risk for Crohn's disease, but it does not offer the same protection against the disease as seen in individuals who do have the protective variant. Your Crohn's disease results tell you about the impact of a protective variant on your risk to develop Crohn's disease. Having 1 or 2 copies of a protective genetic variant decreases your risk of Crohn's disease compared to individuals who have 2 copies of the non-protective genetic variant. Having 1 or 2 copies of a non-protective genetic variant increases your risk of Crohn's disease compared to individuals who have 2 copies of the protective genetic variant. Remember, Crohn's disease is a complex disease. This means that it is caused by a combination of variants in multiple genes and the environment. No single genetic variant causes Crohn's disease, so no single genetic variant will completely predict your risk for Crohn's disease. Results of CPMC testing alone do not diagnose Crohn's disease or rule out the chance of developing Crohn's disease in the future. Genetic variant information can help estimate your risk of Crohn's disease. However, other risk factors, like your family history and smoking status, may have a greater impact on your risk than any individual genetic variant. We may learn of other genetic variants that influence your risk of Crohn's disease in the future. As we learn more, your estimated genetic risk for Crohn's disease may change. We will keep you updated on changes through the CPMC web portal. For more information, consider sharing your CPMC results with your healthcare provider. You can also contact a CPMC genetic counselor, read information on the CPMC health condition page, or attend a CPMC educational event.